Hello and welcome to the third module in our series about youth use of e-cigarettes, how marketing targets youth and adults. According to the CDC, e-cigarette ads reach nearly 4 out of 5 of our U.S. middle and high schoolers, and they do so through a variety of means, including digital, retail marketing, social media, news, and TV. We know that they are very successful at what they do and how they do it. One of the major ways children are reached with e-cigarette ads is through social media. And Juul has since shut down their social media platforms, but before they did so, a study found that nearly 82% of the Juul followers were under the age of 21. And it's important to note that in 18 states, it is currently illegal for anyone under the age of 21 to buy a Juul. So it is truly alarming that nearly 81% of their followers were under the legal purchase age for these products. Another key factor of marketing to youth is the flavors of these products. They are very enticing and they're meant that way on purpose. A lot of the packaging mimics popular candies, apple juice, and other products kids use daily. And we know that the flavors attract kids, and many children who try a tobacco product do try a flavored product first. Other ways that this marketing reaches kids is, again, through the internet and digital targeting. These ads can be pop-up ads on social media or other popular sites. TV and radio is also a platform used by Juul and other e-cigarette makers. Until recently, Juul has declared that they will stop that type of marketing, but that hasn't happened as of yet. It's important to note that they can do this where cigarette manufacturers cannot. That was banned in 1971. However, as e-cigarettes weren't on the market at that time, they weren't included in the law, so they are operating in a kind of gray space right now, and there aren't any regulations against it yet. Retail marketing is one of the biggest ways that these products are marketed to youth, especially in convenience stores and other places like that where they often sell tobacco. So there's a lot of ads that'll say things like Juul sold here. They'll put them near schools. They also sponsor events that are popular with youth, recreational events, music events. They have even been sponsoring scholarships for people 18 and older. They're very good at what they do, and by doing this, they have increased youth use of these products exponentially since 2017. So for those who have tried tobacco, our young people, we know that 4 out of 5 of them did try a flavored product first. That's why it's very important to know what these flavors are, how they're sold, and to talk to your kids about why, just because it has an enticing name like mango or fruit medley, that doesn't take away the risk posed by using these products. E-cigarette makers are also very good at marketing to adults. One of the biggest ways they have done so is by convincing adults that e-cigarettes are a healthier alternative. Currently, the CDC does say that there could be potential benefit for adult smokers who do completely switch to e-cigarettes, but the long-term efficacy of using e-cigarettes for cessation has not been proven yet, and the long-term risk for adult smokers who switch is also unknown. They use very attractive models and advertisements, both for youth and for adults. They also market to adults on the fact that these products are less obtrusive. They don't smell like a combustible cigarette does. You can vape and use e-cigarettes in places that you can't smoke. For instance, in Nebraska, there's not a part of the Indoor Air Act that prohibits vaping in public spaces as of this time. They also market vaping and e-cigarettes as a cost reduction compared to smoking. And they like to reach adults through many of the same platforms that they reach children, particularly radio, digital advertisements, and sponsorships of different events and recreational activities. And how is this done? Like I mentioned, in 1971 was the ban on tobacco marketing at TV and radio. However, at the time, e-cigarettes, of course, didn't exist. They're not included. And we have yet to amend that regulation or create new regulations banning the advertisement of these products on platforms like TV and radio and the internet. So it depends on the makers to voluntarily stop advertising. Right now we have seen several major networks have decided voluntarily to ban these companies from advertising on their TV stations. And Juul itself announced in late September of 2019 that they were going to pull their TV, radio, and digital ads. And until they do, we're not sure what that will look like, but it is in the works. And many of the tactics used in marketing by e-cigarette companies are the same tactics that we have seen throughout the last 50 plus years by Big Tobacco. Thank you all for attending Module 3. Welcome to the fourth module in our series about youth use of e-cigarettes, youth e-cigarette use and disparities. We're going to review some trends locally about who is using e-cigarettes and maybe a little bit about why. So it's important to know in Lancaster County that in 2019, our smoking rate was only 4.4% for combustible tobacco among our high schoolers. That is phenomenal, and it reflects nearly 18 years worth of effort in tobacco control. You can see that in 2001, our smoking rate was at the highest, and it was nearly 30% of our high schoolers were smoking. Now, unfortunately, these positive gains are being threatened by the rise of e-cigarette use among our youth. In 2015, the surveys that we give high schoolers started to ask about e-cigarette use because that's when Juul came onto the market and when these products became more popular among young people. At that time, our youth rate was about 24%, and since 2015, it has increased to about 27.5%. And as time goes on, it'll be curious to see where this trend goes and if it does continue trending upward or not. Some other factors that play into who is using e-cigarettes include things like gender. This is statewide data from 2017 that shows, this is from the CDC, that male students are more likely than their female counterparts to use e-cigarettes in high school, and that's about a 4% difference between male and female students. Another trend use that we see is by grade. Those in 9th grade use e-cigarettes at the lowest level, 12th graders use e-cigarettes at the highest rate, and that's not surprising because a lot of 12th graders turn 18, which is currently the legal purchase age of tobacco products and e-cigarettes in Nebraska, and that age will increase to 19 years as of January 1st, 2020. Another trend or disparity that we see follows the lines of race and ethnicity. In Nebraska, white students in high school are the most likely to use an e-cigarette. They're at about 9.8% versus the general population, which is 9.4%, so very close there. And the second group most likely to use an e-cigarette product is Hispanic and Latino youth, and those trends weren't very surprising as that mirrors the overall population of our state. The final disparity that we see in both e-cigarette use and tobacco use is among members of the LGBTQ community, and these trends that we see here in young people do continue throughout adulthood. And so again, the general use rate in Nebraska in 2017 of e-cigarettes by youth was 9.4%. And you can see, rather alarmingly, that for youth who identified as gay, lesbian, or bisexual, that youth rate jumped to almost 18%. And for those who identified solely as bisexual, that rate was over 18%. So if you know of an LGBTQ youth in your life, it's important to talk to them about how e-cigarette and big tobacco companies do target members of the LGBTQ community, and to just make them aware that for their long-term health and well-being, they should say no to these products and be aware of the marketing trying to entice them. Thank you very much for watching Module 4. Hello and welcome to the fifth and final module of our Youth Use of E-Cigarette educational series, E-Cigarette Addiction and Cessation Resources. In Lancaster County, it's important to know that today's tobacco landscape is vastly different than the landscape that we saw when we were young people. 27.4% of our 9th through 12th graders reported using an e-cigarette in the last 30 days in Lancaster County in 2019, versus only 4.4% of them reporting using commercial combustible tobacco. So what has this possibly led to? E-cigarette addiction in youth is a very real concern, and it's more concerning because many youth are not aware that e-cigarettes do contain nicotine. The nicotine content does vary widely by brand, and since 2013, the nicotine content in e-juice and e-cigarettes has increased over 100%. A lot of this was driven by the introduction of Juul in 2015, which is one of the highest concentration nicotine products currently on the market at either 3 or 5%. And those 5% Juul pods contain as much nicotine as about 20 to 40 traditional combustible cigarettes. So it's important to make your youth aware that by using these products, they are exposing themselves to an addictive chemical that does have a lasting impact on their brains and possibly their futures. If you have a young person whom you would like to help quit, there are resources. The first option is, of course, to always speak to your or your child's healthcare provider about the specific needs of your family. Another thing that has been found to be effective for youth is text or digital cessation platforms. Very recently, the Mayo Clinic and Truth Initiative partnered, and they created a text-based cessation resource for young people called This Is Quitting. It's a 5-week program, and it's free, and youth can access it by texting Ditch Juul to 88709. They found that after 5 weeks, they had about 27,000 young people enroll in this program, so that just gives you an idea of the scope of e-cigarette use among our youth. And they found that 61% of the young people who use this system had within 2 weeks either quit completely or reduced their use, which is phenomenal findings for the beginning of this program. The This Is Quitting program also has a portal for adults that allows you to provide support to your young person as they're trying to quit using e-cigarettes. And you can access that free resource, again, by texting QUIT to the number on the screen. Finally, a resource for those 16 and older in our state is the Nebraska Tobacco Quitline. This Quitline is available for those who are interested in pairing both behavioral counseling and if you're over 18, right now, the Quitline is offering free nicotine replacement therapy, a 2-week supply for those, again, over 18 with no chronic conditions. So all you have to do is call in, you complete a behavioral counseling session, they'll ask you some questions, and then they'll mail you either the gum, the patch, or the lozenge directly to your home. And people can access this Quitline in English, Spanish, or over 100 other languages as well. So finally, it's important, parents, guardians, and youth leaders, that we know the risk of youth use of e-cigarettes, that we take action, and that we protect our kids. This call to action was given to us by the Surgeon General in 2017 when he first declared youth use of e-cigarettes an epidemic across the United States. And you can learn more about the risk of youth use and what you can do in your community, or here in Lincoln, hopefully, at ecigarettes.surgeongeneral.gov. Thank you very much for attending our 5-part series.